Hello everyone, this is module 9, client needs assessment and problem identification. So after completing this module, participants will be able to know about working with clients, learn about client needs assessments, identify client barriers for accessing care, and develop problem solving skills. Having skills in needs assessment and structured problem solving can help solve complex navigation problems. Structured problem-solving skills of the navigators help solve navigation problems in a clearer and structured way. This structured problem-solving skill is a thinking skill which enables clear problem understanding and work through a roadmap. There are certain things that need to be considered while working with clients. The navigator should find out what the patient knows about his or her medical condition. Then the navigators need to arrange face-to-face meetings with patients to develop rapport and trust. They need to find a quiet space that allows for an uninterrupted visit. And during these meetings, they should be able to minimize distractions um, that may resulting from phones, television, computer, and so forth. Navigators should also allow ample time to begin getting to know the patients. And also the navigator should look to utilize the patient strengths during working with patients to help empower them. During the needs assessment procedure, navigators should develop rapport and trust with the client. They should ask questions to identify their needs, and they can ask a mix of open-ended and closed-ended questions. Navigators should also need to make sure that the people understand that though it is difficult to share information on needs with someone, but when dealing with life-threatening illness, client can do this. While performing a needs assessment by the navigator should briefly introduce the patient navigation and the role of patient navigator to the client. The navigator should ask why they are referred to the patient navigation process. They should ask what concerns or barriers might keep the patients from getting to healthcare services. A checklist of potential barriers can be useful in these regards, and the issues can come across are like financial issues, confusing paperwork, appointment scheduling, transportation problems, caregiver needs, primary language other than English, health literacy issues, cultural barriers, lack of social support, um, lack of motivation, that is readiness to access to the services, and knowledge of some of the resources, and several other issues. Navigators should ask the patients thereafter that what would be the most useful to solve their needs. There are certain steps of problem solving. So first is to define and clarify the issue with the patient. What are the problems they face? The next step is to gather and verify the available facts regarding this problem. Then identify other key players that are responsible to solving those problems. Talk with the patients or others to brainstorm the possible solutions to these problems. And after this brainstorming, the navigator should ask the patient to identify the pros and cons of each of the options that has been identified with the patients. Thereafter, the patients choose the best option as their solution with a discussion with the navigators. The next step is to develop an action plan to these solved problems, and finally to follow up to see if the issue is resolved or not by the navigator. The navigator will not be able to solve every patient problem or address every barrier. Uh, Patients may require additional coaching or counseling in those cases. So the navigators may bring a counselor or social worker to work with the patient. Navigator can also refer to other service providers as well to solve certain problems. Let's work out a case study. Jeff has lots of doctor's appointments for his multiple health conditions. He used to drive himself to the doctor, but he can no longer see well enough to drive. He still has his driver's license, but his adult daughter and son keep telling him not to drive for fear that he will get into an accident. Jeff prides himself on being independent, and while he wants to follow his doctor's recommendations and attend his appointments, he feels like he is a burden to his kids to keep asking him for rides. He is very frustrated and has already missed 2 medical appointments for lack of transportations. Now please work out on the previously discussed problem solving steps and find out what could be a solution for this patient. So that ends module 9. Thank you very much for listening.